Chapter 22, Treatment of Irritable Bowel Syndrome, Ulcerative Colitis, and Crohn's Disease. Irritable Bowel Syndrome, IBS, and Inflammatory Bowel Disease, IBD, are conditions of the GI tract. The two major types of IBD are ulcerative colitis and Crohn's disease. Both conditions are linked to inflammation of the GI tract, unlike IBS. Diagnostic tests that are performed to diagnose ulcerative colitis and Crohn's disease include the testing of stool samples, taking x-rays, and performing a colonoscopy. Colonoscopy is performed by inserting a thin tube with a small light and camera at the end into the anus, enabling the physician to examine the colon for inflammation and damage. IBS causes abdominal pain, bloating, and other discomfort. Movement of waste through the colon may occur too slowly, resulting in constipation, or it occurs too rapidly, causing diarrhea. IBS is sometimes called colitis, but it is not the same condition as ulcerative colitis. There's no one specific cause for IBS. Persons with IBS have an overly sensitive colon. Food allergy, stress, antibiotic use, chronic alcohol use, bile acid malabsorption, and infection are possible causes. Some infections may produce stomach and intestinal inflammation like gastroenteritis. Post-infectious IBS may follow an acute bout of gastroenteritis. The four inflammatory diseases of the bowel are ulcerative colitis, Crohn's disease, ulcerative bronchitis, and pouchitis. Ulcerative colitis and Crohn's are the most common and are discussed in this chapter. Ulcerative colitis only affects the colon, and Crohn's disease can involve any segment of the GI tract. Crohn's can also cause inflammation in the eyes, mouth, or some joints. Ulcerative colitis is one of several irritable bowel diseases that produces inflammation and damage to the colon. Ultimately, ulcers form in the lining of the colon and rectum. Ulcerative colitis can occur at any age, but most commonly begins at the ages of 15 and 30 years and affects men and women equally. Ulcerative colitis differs from Crohn's disease in two different ways. Ulcerative colitis produces inflammation in the upper layers of the lining of the small intestine and colon, whereas Crohn's disease produces inflammation deep in the intestinal wall. The exact cause of ulcerative colitis is unknown, but it is believed to be linked to abnormal functioning of the immune system. Crohn's disease causes chronic inflammation anywhere along the entire length of the GI tube from the mouth to the anus, although it typically affects the ileum, the lower part of the small intestine. The inflammation is formed deep within the intestinal wall, which causes abdominal pain. The root cause of Crohn's disease is not known. The body's immune system is thought to target the bacteria that normally inhibit the GI tract, foods, and other substances, recognizing them as harmful invaders. So this chart lists symptoms of irritable bowel syndrome, ulcerative colitis, and Crohn's. So you can kind of see the difference. There are some lifestyle modifications to reduce symptoms of these irritable bowel, ulcerative colitis, and Crohn's. Drugs used to treat IBS include serotonin receptor antagonists like allocetrone, prostaglandin E1 derivatives like lubiprostone, laxatives, fiber supplements, antidiarrheals, and anticholinergics like dicyclomine. The neurotransmitter serotonin controls GI motility. There are a number of types of serotonin receptors. Stimulation of 5-HT 5-HT3 receptors can cause diarrhea, and simulation of 5-HT4 produces constipation. Allocetrone acts as the 5-HT3 receptor. The drug decreases gastric motility and regulates transit through the colon, gastric secretions, and visceral pain. And allocetrone can only be provided from healthcare providers who are in a special prescribing program. Allocetrone is only approved for women with severe IBS when other therapies have failed. The FDA requires physicians to obtain special training before prescribing the drug because it can significantly decrease blood flow to the colon, potentially causing ischemic colitis, toxic megacolon, or death. And this is in a tablet form. Amitiza is FDA approved for the treatment of IBS in women when constipation is the predominant symptom. It increases intestinal fluid secretion, thus improving the consistency of the stool and reducing straining. It activates 2-type chloride channels in the gut, which increases secretions. The increased intestinal fluid volume softens the stool, increases motility in the intestine, and promotes spontaneous bowel movements. So that's available in an 8 microgram and 24 microgram capsule. Bulk forming laxative and fiber supplements are administered to relieve constipation and diarrhea. Polycarbofil is a bulk forming laxative that is FDA approved for the treatment of IBS. It can be obtained without a prescription. Bulk forming laxatives swell in the presence of liquid. Polycarbofil can absorb 60 to 100 times its weight in water to form a gel. Bacteria that normally live in the colon digest the cellulose and polysaccharide fibers. As the bacteria colony grows, colonic bulk increases. The increased bulk causes the bowel to feel full and stimulates peristalsis and transit of contents through the bowel. It also promotes fluid accumulation in the colon. So for our bulk forming laxatives, and there's a few different brand names: Ecolactin, Fibercon, or Fiberlax. It's available in 500 and 625 milligram tablets, and it's over the counter. Diphenoxine, diphenonyloxylate, and loperamide are opioid antidiarrheals that are administered to control watery and frequent stools. Diphenoxine and loperamide are more potent than diphenonyloxylate. Diphenoxine and diphenonyloxylate are Schedule 5 controlled substances in the United States. Loperamide is available without a prescription. Opioid antidiarrheals bind to receptors on the smooth muscle cells of the GI tract. They induce spasms that interfere with effective peristalsis. They decrease propulsion contractions by inhibiting the release of acetylcholine. Diphenoxine is an active metabolite of diphenoxylate. So diphenoxine and atropine is Modafen. So there's 2 drugs there. Diphenonyloxate and atropine. This has a solution and a tablet, it's Lamodal. And then Imodium AD is loperamide, which is available in a capsule, tablets, and solution suspensions. And then we have loperamide and simethicone, which is diarrhea pill with a gas pill in one. Anticholinergic drugs are used for the treatment of IBS when diarrhea is the primary symptom. Atropine and dicyclamine are FDA-approved agents for the treatment of IBS. Atropine and dicyclamine decrease GI muscular tone and motility by producing a nonspecific direct spasmolytic action on the GI smooth muscle. So dicyclamine is bentyl. Comes in a capsule, a solution for injection, a tablet, and a syrup. Medications administered for the treatment of ulcerative colitis are used to induce remission, reduce symptoms, and improve quality of life. Aminosalicylates are administered to patients with ulcerative colitis and Crohn's disease to reduce inflammation. The 4 aminosalicylate anti-inflammatory agents available are sulfasalazine, osalazine, mesalamine, and balsalazide. Sulfasalazine, osalazine, and mesalamine are all formulations that contain 5-aminosalicylic acid. Sulfasalamine and osalazine are also prodrugs. Valsalazide is a prodrug of mesalamine. Bacteria in the colon metabolize the drugs and release the active metabolites. So here we have all the different dosage forms and strengths. For mesalamine, there's a lot of different products, as you can see here. Aprizo, Asacol HD, Canasa, Delzicol, Lieta, Pentasa, Roesa. And it tells you over here what they all are. So we have some capsules, suppository suspensions, and tablets. Osalazine only comes in 250 milligram capsules, and sulfasalamine comes in tablets. Corticosteroids like prednisone are commonly prescribed to suppress inflammation, reduce flare-ups, and treat pain associated with ulcerative colitis and Crohn's disease. Corticosteroids have immunosuppressive actions that may inhibit the abnormal immune system activity associated with Crohn's disease and ulcerative colitis. Corticosteroids prescribed to treat ulcerative colitis and Crohn's disease may also be administered by mouth or rectally in the form of an enema or suppository. So here we have the corticosteroids, budesonide, hydrocortisone, comes in a rectal foam and a rectal suspension, and hydrocortisone plus permoxine, and that's a rectal foam. Given the similarity of symptoms and the similar mechanism of disease progression of Crohn's disease and ulcerative colitis, many agents used for the treatment of these diseases are the same. Aminosalicylates, corticosteroids, immunosuppressants, antidiarrheals, and nutritional supplements are used for the treatment of both Crohn's and ulcerative colitis. Azathioprine, 6-mercaptoprine, and methotrexate are classified as antimetabolites. They are used for the treatment of Crohn's disease to induce remission. So we have the different immunosuppressants. As you can see, methotrexate has a lot of different strengths and dosage forms. Adalimumab, certolizumab, golimumab, infliximab, and natalizumab are immunomodulators that have been approved for the treatment of moderate to severe Crohn's disease or ulcerative colitis. They are administered to induce remission of active diseases and then continued as maintenance therapy in patients who have had unsuccessful results with other therapies. Common ending for immunomodulators is MAB. So infliximab and the infliximab package label contains a box warning that the drug can cause serious infections and malignancies. Patients taking Tysarbi must be enrolled in an FDA risk evaluation and mitigation strategy program. So here we have our immunomodulators listed. We have Humira, Cimzia, Simponi, Remicade, Tysarbi. Patients who have Crohn's disease may develop fistulas. A fistula forms when an ulcer tunnels from the site of origin to surrounding tissues. Fistulas may be located in the bladder, vagina, or skin surrounding the anus and rectum. Anti-infective agents may be prescribed to treat infections that develop in the fistula. Fistulas can be treated with ampicillin, sulfonamides, cephalosporins, tetracycline, or metronidazole. Now we have the summary of drugs used in the treatment of IBS, UC, and Crohn's disease. We'll talk about the warning label since we've already talked about the drugs. So for the serotonin receptor antagonist, Lotronex, it can cause dizziness or drowsiness. Avoid driving, avoid alcohol, take with a full glass of water. Amitiza, take with a full glass of water, take with food. Polycarbophil should be taken with a full glass of water. For antidiarrheals, they can cause dizziness or driving. You should avoid alcohol and drink lots of fluids. For the anticholinergic Bentyl, it can cause dizziness or drowsiness, so you should avoid driving, avoid alcohol, drink lots of fluids, take on an empty stomach, avoid antacids within 1 to 2 hours of dose. For the aminosalicylates, for colazole, we're going to swallow whole, do not crush or chew. The capsule contents can be sprinkled on applesauce. Canasta for UC is a suppository, so we need to remove the foil, then insert. The suppository can cause discoloration to clothing or skin. Rowesa is the rectal suspension, so we should shake well. For these tablets listed here, Asacol, Lida, and Pentasa, they all should be swallowed whole. Do not crush or chew. Take with food, and do not substitute Asacol HD with Delazacol. They're not interchangeable, even though the package looks exactly the same. For osalazine, swallow whole, don't crush or chew. Take with food. Sulfasalazine, swallow whole, don't crush or chew. Avoid prolonged exposure to sunlight because it can cause more severe burns, and drink lots of fluids. Hydrocortisone for the corticosteroids. We want them to shake well. For the suppositories, remove foil and insert. And the shake well is for the Cortima and the Cortifoam. Then for the immunosuppressants, we have Imuran, Trexol, methotrexate, 6-mercaptopurine. So for azathioprine, we want to take with food, avoid alcohol, avoid pregnancy. For the immunomodulators, we want to report signs of infections and do not miss doses.